The last hormone that we have, or I'm sorry, the last adrenal gland, oh my gosh, check that. The last endocrine gland that we have is the pancreas. And we'll probably spend a little bit more time here just because of what the pancreas is and what the pancreas does. Here's the pancreas, this little thing right here. It sits right underneath the stomach, so it is just inferior to the stomach. Okay, and it is unique. It's unique in that it has both a exocrine function and it also has an endocrine function as well. Okay, so it does have different types of cells. It has islet cells, which are endocrine, and it also has exocrine cells. Okay. So we have two parts of this thing. We have hormones that are going to be secreted directly into the blood, and we have those that are going to be secreted via duct. Holy smokes, well, there's a pancreatic duct. And so that's where those exocrine secretions go into. Again, endocrine secretions just enter into the blood vessels that are here and then get into the blood and have their effect. Okay, you've heard of a couple of these hormones. Okay, glucagon, insulin. Those are the alpha and beta cells. Alpha cells secrete glucagon, beta cells secrete insulin. Delta cells, they secrete somatostatins, and these help to regulate the secretions. They turn off insulin secretion when levels start to get within normal range, or they turn off glucagon to turn off the alpha cells when it starts to get back within normal range. Sugars get back to within normal range. Okay. The exocrine secretions are all digestive enzymes. Okay, these are enzymes. Okay. Insulin and glucagon, those are the two big. INSULIN, insulin and glucagon. These two are the most important. Delta cells producing somatostatins. Okay, it's important, yes. But really our concept of insulin and glucagon and what the heck those things do, those are the most important. So again, we have a number of terms here. Glucose. Glucose means sugar. Okay, it's the most simplest carbohydrate that we have, or one of the most simplest. It's one of your simple carbs. Okay, this is sugar. Okay, this is sugar. Gluc, G-L-U-C, means sugar. Okay, os is the suffix, O-S-E, full of sugar. Ta-da! I know, it's weird. Glucagon, again, is secreted by alpha cells. I'm going to put alpha cells here. Alpha cells secrete, because I want you to know that, because understanding diabetes, which is involving the pancreas, is something important to know. Okay, so glucagon is secreted by these alpha cells. Again, gluc, G-L-U-C, means sugar or glucose. It's usually what it refers to. And then agon, so with G-L-U-C and then A-G-O-N, agon, means to fight. So we are fighting for glucose, which seems really weird. When glucose levels drop within the blood below 70 milligrams per deciliter, we are fighting for glucose. Glucose's function is to provide us with energy. It's our primary energy currency for the body, and even more so for certain types of cells. So when our levels of glucose are low, we need to fight for it, I guess, whatever. So our body fights for it. So it goes to our stores. We store sugar in our body as glycogen. So we release glucagon, it goes to our stores of glucose, glycogen at this point, and destroys it, breaks it down. Glucose levels rise back in the blood and everybody's happy again. If I skip a word and go down one to glycogenolysis, this is that destruction of glycogen. G-L-Y-C-O-G-E-N, glycogen. long-term storage. Long-term glucose GLU storage. That's in us. Long-term storage in a plant is starch, cellulose. Who cares? Okay. Glycogenolysis. Lysis means to destroy, to break down, to separate. Glyco means glycogen. Okay. Geno means to create. Genesis, formation of, right? Gen, formation. So we are forming glucose from the destruction of it. Okay. Lysis, to destroy, to break down, to separate. Gen, to create. And glyc is sugar, glucose. So we are creating sugar from the destruction of glycogen. Gluconeogenesis. Genesis, there you go, at creation. Neo is new. I'm sure we can figure out what the book of Genesis is about. And the Genesis means the same basic thing here. Formation of. Neo is new. This is a new form of glucose. Okay. This is a new form of glucose. This is from non-carb. New form of glucose. And let me do that. Of glucose. Non-carb source. Okay. Gluconeogenesis is a new form of glucose from a non-carbohydrate based source. So, what does that mean? Where's it coming from? Proteins, sure. Some fats, sure. Okay. It's just a non-carb based source. Again, please understand where all these come from. Okay. The pancreas has islets of Langerhans. Okay. We have alpha. We have beta. We have delta. Okay. This is the delta. This is the beta. And this is the alpha. Okay. Glucagon is secreted from the pancreas by the alpha islets of Langerhans. Insulin is secreted from the pancreas by the beta cells, the beta islets of Langerhans. Somatostatins are produced by the pancreas, released from the pancreas, produced by the islets of Langerhans delta cells. Raise blood sugar, lower blood sugar. Insulin helps to facilitate the movement of glucose into cells. So glucose is awesome. Glucose is fantastic. Okay. Insulin is not bad. It's doing its job. It's your job not to eat so damn much sugar, and then insulin won't be a problem. So if you listen to influencers and they say insulin's the problem, no, it's your diet. And that's hard to hear. When something is your fault, you don't like hearing that. And it's a you thing. Okay. With type 2 diabetes, it is a you. With type 1 diabetes, okay, that's not you. You were born that way. Your cells have been destroyed for some reason. There's a number of different causes for it. And that's not your fault necessarily. Okay. But type 2 diabetes is. Okay. Diabetes mellitus is diabetes. Type 1, born with. Type 2, acquired. Acquire with poor lifestyle. Not eating properly, not exercising. That's type 2 diabetes. Okay. So we just call them type 1 and type 2. You can call it insulin dependent, non-insulin dependent, but most everybody refers to them as type 1 and type 2. Okay, so I don't think I'm going to ask you insulin dependent and non-insulin dependent. But if I was, type 1, you need insulin. Okay, this is insulin dependent diabetes mellitus. You need insulin. Okay, need insulin. You don't have any alpha cells. Or I'm sorry, no, you have no beta cells. And if you have no beta cells, you have no production of insulin at all. So the sugar just stays within your blood, and that causes a number of obviously poor health outcomes. Type 2 is non-insulin dependent diabetes mellitus. With type 2 diabetes, with these poor health choices, if you keep eating sugars or fats, both most commonly, okay, your body produces insulin more. You eat more carbs, you eat more glucose, you eat more sugars. You have to produce more insulin. You have to produce more insulin. If you keep eating them, keep shoving them in, this requires these cells to be very active and produce a whole heck of a lot. They get tired, they crap out, and they don't produce as much as you need anymore. And so you get this impairment of insulin being effective enough for the glucose that it has to respond to. Stop shoveling it in. Will it probably require insulin? Yes. We just have an insulin insufficiency here with type 2. Can you turn around type 2 diabetes with diet and exercise? Yes, you can. I guess that's why they refer to it as non-insulin dependent diabetes mellitus. With type 1, you need insulin. You don't have the cells. In type 2, they've just pooped out. Gestational diabetes is just diabetes that happens during pregnancy. That's it. Gestational refers to the time during which you are carrying a child. So if I was to ask you gestational diabetes, who does it affect? It affects pregnant women, okay? Which can then obviously affect the carrying fetus within inside mom as well. And there's a number of studies to show all the fancy pants negative health outcomes for long-term health with that child. So there are some ramifications for it. Okay, mature onset diabetes of the young. Let's do this. Okay, there you go. I'm not even going to talk about it. Again, defining definitions here. I'm sorry, abbreviations: DM, diabetes mellitus, IDDM, insulin dependent diabetes mellitus, NIDM, non-insulin dependent diabetes mellitus, and GDM, not gosh darn it, gestational diabetes mellitus. Again, with this one, I kind of go into it just a smidge here. Okay, a little bit more in depth just because of what diabetes is. Pancreas involvement is super involved with a lot of things. Again, hypoglycemia, what is it? Hypo, diminished, GLY, glucose, emia, blood. So this is decreased blood glucose levels. Some of the signs and symptoms of it: shaking, confusion, and it can lead to coma if we don't get that up enough, because your brain requires a lot of sugar and your brain just kind of shuts down. Treatment for it here is just give some glucose. Usually give a sugary beverage. Okay? 3 to 4 ounces of fruit juice usually improves hypoglycemia pretty damn quick. It can lead to insulin shock. Okay? I don't believe I've asked it on the exam, at least I don't think so. But insulin shock is what it can result in. This is not good. Insulin shock, not good. Hyperglycemia, what is it? Hyper elevated glucosemia blood. So this is elevated glucose within the blood. Okay. there are three common signs associated with hyperglycemia: polydipsia, polyphagia, and polyuria. And I have them listed on the next slide, and we'll go over what they are. Okay, but these are very classic signs associated with hyperglycemia. Poly means many, elevated, so you can imagine what's going on here. It can lead to diabetic coma, which is obviously very life-threatening. You don't want to be there. It can also result in what's called diabetic ketoacidosis. And this is due to an imbalance within sugars and fats and how the body is using them. If you come to nutrition class, we go over it a heck of a lot more there and how that happens, why the body is confused on sugars and fats, and why that leads to this thing called ketoacidosis. So we talk about it a little bit more there. Shorthand, they call it DKA. That can lead to a diabetic coma if you don't get that diabetic ketoacidosis under control. It can screw with the body's pH and put you in a diabetic coma. And it can be a very scary thing. When it comes to this hyperglycemia, knowing these signs and symptoms are pretty important because it can be asymptomatic. Okay, you could be having this and not really know it. But knowing what polydipsia, polyphagia, polyuria are, you can help to prevent that. Because again, you may not be noticing those tiny little blood vessels in your eyeball are being damaged. That can lead to vision issues later down the road, tens and tens and tens of years later in life. Kidneys can be affected, small blood vessels. Nerves can be affected. Okay, so there's a lot of things that start to manifest 10 plus years down the road. Paying attention to some of these very common signs and symptoms can help prevent that. Again, what do these words mean? Well, poly means many or excessive. Poly, poly, poly. I'm going to write down here, poly. Many. Excessive. Okay. We have dipsia, we have phagia, we have urea, IA. I see some commonalities here. Let's make it simple on ourselves, for gosh sakes. Okay. IA. All it means is condition. Okay. So we have a prefix, we have a suffix. Poly always means many. IA always means a condition. So now all we got to look at this word as the root word. Okay, dips. Phage. Urine. Phagosome is a cell in your body that eats. Phagocytosis, cell eating. Phage, eat. And dips, thirst. Excessive thirst, excessive eating, and excessive urine production. Well, urine and thirst kind of go hand in hand, right? Polyphagia, increase hunger, increase your desire to eat. And that's just because you're not able to use your glucose properly. And again, glucose is its primary function is to provide units of energy. If you're not getting enough energy, you're going to be more hungry. You want to eat more. So that's where that eat comes from. Okay. Again, paying attention to what these very common signs and symptoms are for hyperglycemia can help prevent some nasty things down the road. Again, how can you treat it? Diet and exercise. Type 2 can prevent it. With type 1, you treat with insulin. You also have to have a good diet. Exercise is unique with a type 1 diabetic. You have to monitor it because you can get massive spikes when you exercise. So I wouldn't necessarily put exercise as something with type 1 diabetes. Obviously, patient education to understand the signs and symptoms, to understand food education and what the heck means, what you're putting in your mouth. You do a lot of glucose monitoring, again, kind of keeping your blood glucose within 70 to 100 milligrams per deciliter. You don't want to get too low, hypo. You don't want to become too high, hyper, and become diabetic. Assessment of the patient, again, looking, going to a doctor, having a physical assessment every 6 months. Periodic labs, these are just to check for glycolated hemoglobin A1C. There's a number of kind of things, markers that you can look for in the blood to see if there's excessive sugar within the blood. If you're glycolated hemoglobin, they're looking for sugar coating glucose excessively. And A1C is the marker. It's a marker for inflammation, excessive glucose. Let me go here to this one again. BUN is blood urea nitrogen, DKA, diabetic ketoacidosis, HbA1c, that's what I was just talking about, that glycosylated hemoglobin. Again, it's a great kind of way to see if something's been going on for 30 plus days. It really gives you an idea of how long you've been having this excessively high glucose within your blood. So it's a nice way to assess pancreatic function. All of these are. Blood urea nitrogen looks at kidney function. Ketones, these are just chemicals. That are made during diabetes, chemicals made during diabetes. They're made during starvation as well. They're made in anybody who doesn't eat carbs. If you don't eat carbs, right, you're one of those keto people. You want to get in ketosis, and ketosis is just a situation in which we've made an overabundance of ketones, these chemicals. Again, sugar imbalance. Ketoacidosis, this is when we have an excessive amount of ketone production, but it changes the pH of the blood and makes it more acidic. That can lead to metabolic acidosis. And it could be a pretty significant sign of diabetes, uncontrolled diabetes, usually type 1 in that case. Last one, acetone. This is the most common ketone. Most common ketone. And you exhale that one. Your breath smells like fruity. There you go. Okay. There's like 3 major ketones. This is the most major one we have. See you all next time.